Bismillahirrahmanirrahim. Now we'll be continuing our local anesthesia topic. Discussing further, we'll talk about epidural anesthesia. Now, this anesthesia is very similar to the spinal anesthesia, but the positioning of the drug deliverance is quite different. Now, we'll enter to the stream route by entering the skin, the subcutaneous tissue, crossing the various ligament, entering into the epidural space. Now, these drugs are only delivered into this space. By crossing this space, we will enter the spinal anesthesia space. So, a catheter is placed over this respective area, and this is kept during and after the operation for its full anesthetic effect. Now, this type of anesthesia is commonly given in orthopedic surgery because there is a lot of pain during and after the procedure, so an adequate amount of analgesia is created in order to overcome that pain. Now, these drugs are given in slow infusions and they are independent of overdose-like effect. The various complications of epidural anesthesia include infection. It is basically through the route of entry. It can also cause spinal cord damage as well as can lead to hematoma formation. Now, we'll discuss the various differences between the spinal anesthesia and epidural anesthesia. Spinal anesthesia involves injecting the anesthetic drug into the cerebrospinal fluid. As we have seen here, we basically inject a needle up to the CSF, whereas in epidural anesthesia, we only go up to the epidural space. Now, spinal anesthesia does not need a catheter because an anesthetic effect is only regulated up to a few hours, whereas the anesthetic effect in epidural anesthesia can be regulated up to many hours even after the procedure. Now, spinal anesthesia can be used for lower limb surgeries as well as pelvic surgeries, whereas epidural anesthesia can be given for lower limb, pelvic surgeries, and even in child delivery, which is elective C-sections. Now we'll go towards mode of onset. Now, its spinal anesthesia onset is up from 2 to 5 minutes, whereas epidural anesthesia takes its full effect from 20 to 30 minutes. Its duration of effect of spinal is 2 to 3 hours, epidural is 3 to 5 hours. Drug volume that is given into the CSF is approximately 2.5 to 4 ml, whereas in epidural it's up to 20 to 30 ml. The quality of block is rapid surgical anesthesia, and epidural may be inadequate due to some dermatomes.